I get asked a lot about at-home cosmetic parties, whether it's at-home Botox parties, microneedling parties, chemical peel parties, those kinds of things. In general, I'm actually okay with these types of parties, as long as the people going to the parties have done their research. You need to know who is providing these services. You need to know if they're licensed. You need to know if they have malpractice covering any sorts of problems or complications that can arise. I actually have a couple of my own nurses who host some of these parties themselves, and they do a great job. They're licensed, they have a business license, and the parties are done very professionally in a very clean, very safe environment. Typically, when you're doing these types of parties, you're not doing a procedure that would require a completely sterile environment like an operating room. Rather, they're sort of soft spa procedures that you can do in a clean room, like you could do at any medical spa. However, again, safety is the number one concern. And it's not just these at-home parties that you need to do your research on. It's any time you select a plastic surgeon to go with your treatment that you're wanting, right? And this is where it can really get confusing, especially here in Utah, because my biggest competition in Utah is actually not other plastic surgeons. It's people who do plastic surgery that are not plastic surgeons. Where that gets confusing is you have to say in this state whether or not you're board certified. What you don't have to reveal is what you're board certified in. And so you can get some very clever marketing tactics from people who did a residency in, say, family medicine or oral surgery. Not to throw stones at any particular surgeon here in Utah, but there is a very prominent oral surgeon who markets himself as a plastic surgeon. He does everything plastic surgery head to toe. The reason that this is critical to know is you want somebody whose training centered solely on plastic surgery. For example, myself, I spent 6 years in an integrated plastic surgery program where it was plastic surgery from year 1 to year 6. Older surgeons who trained years before integrated programs were available oftentimes went through either 5 years of general surgery or 5 years of ENT training, and then did an additional 3 years of plastic surgery fellowship. So they have an extensive amount of training and a long period of time where they're focused specifically on plastic surgery. Where this can get confusing and scary for patients is in cosmetic surgery and plastic surgery. The reason this gets confusing is because there are two different boards that certify these physicians. There's the American Board of Plastic Surgery, which is where my license is from and my board, and where you want yours to be from, depending on what doctor you choose. There is also the American Board of Cosmetic Surgery. That board does not require that you've gone through a plastic surgery training program. You just have to do either a 6-month or a 1-year fellowship in some sort of cosmetic surgery after any other type of training. So you can be a family medicine trained doctor, which is about 3 years of residency training with almost zero experience in surgery. And then you can go shadow somebody for 6 months and watch them operate and take a weekend course in breast augmentation. And then you can call yourself a board certified cosmetic surgeon. And so if you're the average patient looking at who to go to and you see this great marketing campaign about this incredible board certified cosmetic surgeon, but you don't know those nuances, the difference between a board certified plastic surgeon and a cosmetic surgeon, you might choose somebody who's drastically unqualified for the procedures that you are wanting to have done. Here's a tip that I give my patients, and this applies to these at-home parties as well. You want to ask for people's resume or training. What I tell patients to do when considering a plastic surgeon is go to the website of whatever practice you're looking at. Click on the menu. There should be an About the Doctor tab on there, or About the Staff, somewhere where you can read a little bio on that particular surgeon. It will tell you his or her training. It will tell you where they went to undergraduate, where they went to medical school, and where they did their training. And it should tell you what their training was in. So it may say, Dr. So-and-so went to undergraduate school at the University of Utah. He then did medical school also at the University of Utah, and he completed his residency at The Ohio State University in pediatrics. That should be your red flag right there. If that residency program was not specifically in plastic and reconstructive surgery, then you should have a red flag up. My route to plastic surgery was the shortest route possible. And the reason for that is there's not a lot of integrated spots where it's 6 years after medical school. So some surgeons will go through either general surgery or ENT training. So if you see that they went to medical school and then did a residency in general surgery or ENT, that's okay. You then also want to look for what they did after that. Did they do a fellowship in plastic and reconstructive surgery? Those are the people you should pick as your plastic surgeon. The other dead giveaway for it is you will see prominently displayed on their website or in their office 2 logos. The American Board of Plastic Surgeons logo looks like this kind of old-timey face, and it says American Board of Plastic Surgery around it, or the American Society of Plastic Surgeons, which looks like a blue circle that's been kind of hand painted. You are not allowed to display those logos without board certification in plastic surgery. That's the easiest way to know. The other easy way to know is just ask them, where'd you do your training? Where did you do your training in plastic surgery? Did you do a fellowship program? Those are big, major questions, and those are the things you want to look out for. As far as these at-home parties go, similar questions. Where are you trained? Do you have malpractice insurance? What are we going to be doing? What's the protocol if something goes wrong here? If I have a complication from this, how will you take care of me? And there should also be consent forms that you're signing before any type of a procedure. Those are the things to look for.